I get it when you've been dealing with arthritis flare-ups for years. Every new gadget feels like a gamble. You've probably Googled best thing for joint pain a dozen times, read a handful of glossy ads, and still end up wondering if you're about to waste money on something that looks fancy, but does nothing. That's the exact spot I was in last month, scrolling through forums, watching endless testimonials, and trying to figure out whether a red light therapy mat could actually make the difference between sitting on the couch in pain and actually moving around without that constant ache. Link is in the description if you want to check the product details on Amazon. The thing about red light therapy is that it's been around in clinical settings for a while, but the home use versions are still a bit of a Wild West. The mat we're looking at claims 3 different modes: a focus on arthritis and joint inflammation, and a clinical laser disease treatment label. None of that is magic on its own. The real question is how it fits into a daily routine and whether the promised anti-inflammatory effect translates into measurable relief for everyday folks. First off, let's talk setup. The mat arrives rolled up in a compact box, unpacks into a flat rectangle roughly the size of a yoga mat, and plugs straight into a standard wall outlet. There's a simple control panel with 3-mode buttons: low, medium, and high intensity. You lay it on the floor, on a bed, or even on a recliner, step onto it, and let it run while you watch TV or read. No complicated calibration, no need for a special app. For anyone who isn't tech-savvy, that's a huge plus because the barrier to actually using it is low. You can literally start a session in under 2 minutes. Now, where the value really shows up is in that hands-free aspect. Most other red light devices are handheld panels or small pads you have to hold over a specific joint for a few minutes a day. With a mat, you can treat multiple joints at once: knees, hips, lower back while you're already sitting or lying down. If you have knee arthritis and also get occasional wrist pain, you can place your feet on the mat and rest your forearms on it simultaneously, letting the light work on both areas without you having to switch devices. That's a practical strength you don't see in the spec sheet: multi-target coverage without extra effort. On the flip side, the mat size can be a hidden trade-off. It's large enough to cover a full body area, but that also means you need a decent amount of floor space to lay it out without it rolling onto a rug or getting tangled in cords. If you live in a small apartment where every square foot is precious, you might find it cumbersome to set up and store. Also, the 3 intensity modes are labeled simply as low, medium, high, without any numeric wattage or wavelength details. That makes it tough to compare with other brands that publish exact wavelengths, like 660 nanometers red and 850 nanometers near-infrared, which are often cited in research. In other words, you're trusting the manufacturer's claim that the clinical laser label is accurate, but you don't have hard data to verify it. The biggest practical question is the timeline for results. Red light therapy isn't an instant painkiller. Most clinical studies suggest you need consistent daily sessions for at least 4 to 6 weeks before you notice a reduction in inflammation markers or joint stiffness. If you're looking for a quick fix before a big event, say a wedding dance or a weekend hike, you might be disappointed. The mat is better suited for people who can commit to a routine, a 20-minute session each evening after dinner, for example. Those who expect immediate numbness or a cure after a single use will likely feel shortchanged. Who should buy this? If you have mild to moderate arthritis, especially in the knees, hips, or lower back, and you're already exploring non-pharmaceutical options like physiotherapy, stretching, or topical creams, this mat can be a useful adjunct. It shines, pun intended, for anyone who wants a passive treatment that fits into existing habits: watching a show, reading a book, or even meditating. It also appeals to people who dislike the mess of creams or the side effects of oral anti-inflammatories and are comfortable with a low-maintenance device that just plugs in. Who should skip it? If you have severe joint degeneration that already requires prescription medication, joint injections, or surgical evaluation, a home red light mat is unlikely to replace those interventions. Also, if you're prone to skin sensitivities, you'll want to test a short session first. Red light can cause mild warmth, and some users report a tingling sensation that isn't comfortable for them. Finally, if you're on a very tight budget, remember this isn't a cheap gadget. The price point sits in the mid to high range for home health devices, and you're essentially buying a long-term commitment. Let's talk about hidden costs beyond the purchase price. The mat draws a modest amount of electricity, nothing that will spike.